Hi everyone, I am Dr. Andi. It is time for today's Facebook Live, everyone's favorite day of the week. While I give everybody the opportunity and the chance to log on, I will just give a brief introduction to who I am and a little bit about my background. So I am a naturopathic physician. I have been in practice for about 11 years now. I work in Toronto. It is actually beautiful and sunny here. We are getting a second summer in the middle of winter. We had snow last week and all of a sudden we have beautiful warm weather this week, which is absolutely wonderful. I work in a practice and run a practice in downtown Toronto where we focus on hormonal balance, metabolic nutrition, fat loss. We work a lot with chronic illness, fibromyalgia, chronic fatigue, chronic pain, Lyme disease, and we have a really large focus on cognition, cognitive health, traumatic brain injury, working with, concussions or those who are suffering from cognitive decline, so treating and reversing or preventing Alzheimer's. We have about 19 providers in our clinic, and our foundation is low carb and keto. I have been an educational specialist on everything keto from the very beginning. It's something that I personally have done in my own life since my early 20s. My own health path sort of had me stumbling across it. It's something that I have used since the very beginning, and it's something that I started to introduce into my practice, into my patients, and obviously exogenous ketones have made a significant difference. So I'm seeing all of your questions come in, so I'm just going to dive right in and get started. I want to make sure I can answer as many as I can. Feel free to just keep posting them. I answer what I can see. So keep posting them. Hope they get to all of them today. So first question, can exogenous ketones cause weight gain? So no, they shouldn't cause weight gain. But what I often see in terms of the weight gain and in terms of fat gain is when people transition into a ketogenic lifestyle, but they're slowly transitioning into the lifestyle, but they increase their fats because we know we need high healthy fats and we haven't decreased the carbohydrates. So you end up high fat, high carb. So I often see that very frequently. And then of course you're just going to have weight gain if you're both high fat, high carb. Absolutely you're going to gain weight. And also in a ketogenic diet, it is possible to overconsume fats as well. So you absolutely can overconsume your fats. And so if you find that you're starting to gain weight, you have to take a look and figure out what happened in your lifestyle. Are you trying to sort of follow some of those keto principles, but you haven't really committed? So now you're high carb, high fat, too much fat. I find that those are often what I see when someone tells me that they're starting to gain weight when they first started transitioning into this lifestyle. Is the reboot advisable if you have gallstones? So again, if you have any medical condition, you have to talk to your healthcare provider to make sure that that is safe for you. I do have patients who have engaged in extended fasting who do have gallstones, but you have to, again, speak with your healthcare provider, make sure that's safe, make sure that there's nothing going on that might make that a risk for you and your health. Any thoughts on cirrhosis of the liver and ketones? So if the question, will ketones be harmful to the liver if you have cirrhosis? So no, it's not going to be harmful. Again, if you have a medical condition, talk to your healthcare provider. But no, it shouldn't cause any detriment to the liver, or if you have cirrhosis of the liver as well. But again, you have to work with your healthcare provider. And then important to look at other lifestyle factors that might be contributing that need to be adjusted or adapted. There is often a lot of concern about exogenous ketones impacting liver or kidney health. And what we have found is studies are actually showing that they are supportive with respect to, they're starting to show that they're actually supportive with respect to kidney and liver function or liver health in general. So again, those are a lot of concerns that people might have. But we also know that exogenous ketones or beta-hydroxybutyrate can encourage the production of glutathione. Glutathione is one of our primary antioxidants. It supports our detoxification, supports that detoxification which goes through the liver. So we know that there's a really great detoxification and supportive aspect from that as well. So no, we don't see any harm to the liver or the kidneys in general, but again, always work with your healthcare provider. Hair loss and keto. So I'm going to tie hair loss and keto into hormones in keto. And I see some questions about hormone regulation as well with the ketogenic diet. So the only time I see hair loss in keto is when someone is doing the ketogenic diet incorrectly. And that's when somebody is following a low carb and low fat diet. So you're eating sort of protein and veggies and that's it. And you're not having the fats that you need, which are necessary for hormone production. And it's that decline or that disruption in hormones that I often see will lead to changes in hair and the hair loss. So we'll often see dysfunction or disruption in your thyroid hormone. But again, that's only for following the diet incorrectly. We don't see that with exogenous ketones. We don't see any disruption in your thyroid hormone in any way or any other of your sex hormones, and you shouldn't experience hair loss either. I also think it's important when you start to experience hair loss, the way our hair follicles and the hair cycle works, you have to look at what happened 3 months before that or even further back. It's not as though you change something this week and now your hair is going to start falling out. It's usually what has happened 3 months prior to the time you started to note the hair loss, and that's what you have to look into. So if that did correspond to when you started your exogenous ketones or a ketogenic diet, then make sure from a dietary standpoint you're getting all of those fats in, and that so that you're maintaining that hormonal balance. And the other thing is just to make sure that your minerals are optimized. Make sure you've got your electrolytes, your magnesium, things like that, your B vitamins. Make sure that all of those are optimized as well. And then other things you want to take a look at would be hormonal disruptions, as I was mentioning. So you want to look at thyroid, but also if you're having a decline of estrogen, for example, or you want to look at B12 and iron levels as well. Can ketones contribute to UTI or bladder infection? So ketones are not going to contribute or cause a UTI or a bladder infection. The only time I say you want to be cautious is if you do have a bladder infection, you need to be drinking significant amounts of water. We know that the ketogenic diet or exogenous ketones can often act as a bit of a diuretic, so you're losing fluids. So it's not going to cause an infection in any way, but if you do have an infection, you have to make sure you're staying really well hydrated and that you're compensating for any loss in minerals. So you have to make sure that you're absolutely taking your electrolytes, you're drinking a ton of water. That's very important because again, you can't be dehydrated if you have a UTI, and we know that there can be a bit of a dehydrating impact. So you want to make sure that those things are balanced, but it's not going to cause a bladder infection. What happens if you drink 3 Keto NATs in a day? Nothing, aside from hopefully you feel great when you consume them. You can absolutely consume your ketones more than once a day. I usually encourage if somebody is new. If somebody is new, then absolutely you want to start with just 1 a day in the morning, but I have people taking it twice a day, and then I usually encourage a 3rd time a day if there's some kind of therapeutic outcome that I'm looking for. Somebody also asked about mixing their ketones at night. And I don't know if that was you mix them at night and you want to consume them, or you're mixing it at night to drink the next morning. Either is fine. You can absolutely drink your ketones before bed. That's not a problem. And if you mix it the night before to consume the next morning, that's okay. I generally just don't encourage just sort of sipping slowly throughout a day. You want to sort of consume it all at one time to get the highest blood ketone level. So dry skin, dry eyes, sort of what I mentioned a little bit earlier, making sure that you're staying hydrated, make sure that you have all your electrolytes, your B vitamins, make sure that absolutely you're addressing all of the hydration factors. So if you're noticing dry skin, dry eyes, then make sure you're staying hydrated. If that's just a condition, you also want to actually get that checked out because it could be other autoimmune imbalances that you're experiencing, Sjogren's, things like that. So you want to just check it out and make sure there's nothing else going on that might be contributing to that as well. So are pure therapeutic ketones good for autism? So there's a really great website. I always refer people to the Charlie Foundation when they're looking for information on autism and ketones. What they have discovered is that the brainwaves of a child suffering from autism are very similar to the brainwaves of a child with epilepsy. And we know that the ketogenic diet was created by a neurologist to manage seizures in children suffering from epilepsy. And what they noted is, again, those brainwaves are quite similar. And the ketones, the beta-hydroxybutyrate, impacts the brain waves in the same way it does in someone suffering from epilepsy. And so they suspect that this is why we see some of the benefit from beta-hydroxybutyrate in those who are suffering from autism or those who have autism because of the impact that it has on the brain. So there's some really great research going on in that space right now. And I'm going to tie this in, actually. I saw another question a bit earlier just about brain health in general and cognition. So Again, we also know that that ketones are a really great fuel source for the brain, especially when our brain's ability to make use of glucose is impaired. And that's not only when we have a brain injury or, concussion or cognitive decline. The decline in our brain function happens many years before we develop symptoms. So our brain, again, given certain lifestyle factors, is slowly having that impaired glucose metabolism. And so what we want to do is provide a fuel source the brain can use. If it's not able to use glucose, it downregulates. Downregulating function because they don't want to ask for more fuel it's not getting. So it sort of decreases the function to decrease the demand of fuel that isn't there. So this is why you want to supply a ketone body, because the metabolism of ketones in the brain is not impaired. And so this is where some of that research is looking again at how it can fuel the brain. Really great research looking at Alzheimer's and improvement in those suffering from Alzheimer's as well. There have been some human trials that have started in that as well. Why does hair loss occur? I just touched on that a little bit earlier. So feel free to just sort of rewind a little bit. I talked about hair loss a little bit earlier. Could Keto NAT help a baby with acid reflux? I wouldn't actually encourage this for a baby with reflux. There are a lot of other issues that contribute to a baby with reflux, but I wouldn't actually encourage using ketones as the primary reason for that. There are other things that you should be looking into, and there are some, some things to bring some of that acid level down. And this is aside from medication, obviously. My little one suffered from some reflux as well. So just some dietary changes from mom if you're breastfeeding or using an organic goat milk formula, if you're formula feeding. So things like that are often very helpful. There are some supplements you can use as well. But no, I wouldn't recommend using ketones specifically to address reflux in a baby. I got really sick from ketones. So I'm not sure what you mean by sick exactly. I don't know. I saw some questions earlier about diarrhea. I saw a question earlier about keto flu, and keto rash. So it might have been one of those few things. So I'll touch on both of those. And questions about ketones, bladder, and bladder infections, I touched on a little bit earlier as well. So somebody who feels like they're getting sick when they transition into a ketogenic lifestyle or start taking exogenous ketones, the first thing is if you're experiencing diarrhea. I've talked a lot about hydration today, so that's generally, we want to make sure you're staying hydrated, make sure you're getting your electrolytes in, and then just reduce how much you're taking until your body adapts. So maybe take half a sachet or a quarter of a sachet until that goes down, and then slowly increase to the full serving. If you experienced a keto rash, I always say when someone has a keto rash, it tells me the nutrients that they are deficient in. I obviously have a lot of my patients who have gone keto. I've never had a patient develop a keto rash. And so you just have to make sure you're getting the correct nutrients, your magnesium, make sure you're getting your electrolytes, your B vitamins, and even just a foundation multi. So those are some things that I would encourage to prevent the keto rash and also to prevent the keto flu. So I'm wondering if that's what you were referring to when you said that you started and you felt really sick. I'm wondering if it was actually the keto flu that you were experiencing, which is just your body sort of transitioning into a ketogenic diet. There's a bit of a detox effect that can also happen there as well, that the change in our mineral and electrolyte balance. So again, using things like magnesium, electrolytes, or B vitamins can help decrease that. And I find that taking exogenous ketones helps to decrease the keto flu if you're transitioning into a ketogenic diet. Should I count calories? Should I count calories? I'm seeing that question a fair bit. So interestingly, I don't have my patients count calories in the very beginning. I find that I don't want to create any sort of food obsession. I'm more concerned about what you're eating. And so when I don't generally have patients start counting calories unless there's a weight loss goal and you're not hitting it with the dietary changes. So I generally, when I'm starting patients on a fat loss diet, I will start with intermittent fasting, always the intermittent fasting, 16 hours from dinner until your first meal the next day. And then you have 2 meals left in the day, and I always say only one of those meals can contain a carbohydrate. Everything else has to be protein, tons of veggies, and make sure you're including a really healthy fat in all of your meals. And I find that doing that is a really great start. And that's a really great sort of transition into keto. And the only time, again, that I'll start counting calories is if somebody is gaining weight, or they're just not losing any weight, they're not hitting their weight loss goals. And so then I'll say yes to count your calories, track your food for a week or two, find out what you're actually consuming. Sometimes people are over consuming the fat. So that's the only time I'm going to look at calories in your macros, but I generally want people to get away from counting their calories religiously and just get a better sense of how they should be eating in a day. So no, not generally, but I will have them count calories if they're not getting the outcome that they're looking for. So questions about type 2 diabetes, and I actually saw an FDA question. So it's also important to remember that the FDA doesn't certify or approve natural health products. So what they will do is provide guidelines that need to be followed and that companies need to make sure that they're abiding by, but there's no sort of official stamp of approval by the FDA for supplementation. Lowering cholesterol, actually, sorry, I was about to talk about diabetes. So let's talk about type 2 diabetes first. So when it comes to diabetics, this is the only group of people that I say need to be cautious right off the bat. You need to make sure if you're diabetic, type 1 or type 2, that you are a controlled diabetic. The concern is always diabetic ketoacidosis. You cannot go into ketoacidosis if you have insulin in your system. It's just impossible. There's this negative feedback loop. It won't happen. But obviously, if you're type 1 diabetic, you're not making insulin. If you're late stage type 2 diabetic, you're also often not making insulin. You're taking insulin. So these are the people that need to be careful. So those are the ones that need to be cautious. And I always say with the diabetics, you have to track or measure your blood ketone levels as regularly as you're tracking your blood glucose levels. Work with somebody who is well-versed in the ketogenic diet and exogenous ketones to help you along the way. You absolutely can take them. You have to work with your health provider, but you have to make sure you're doing it properly. Low stomach acid. So I don't know if the question is this safe to take if you have low stomach acid? Yes, absolutely. If you have low stomach acid, this shouldn't be an issue. Obviously, there are the things you should be doing to address the low stomach acid in general. But yes, absolutely, you can take it if you have low stomach acid. So cancer and Pruvit, can you take Pruvit products if there's someone suffering from cancer? So this one, you have to work with your oncologist. There's so much going on, so many moving parts. You have to work with your oncologist, make sure that they say that that is safe for you. There's some really great research that is coming out showing that the beta hydroxybutyrate might play a role with respect to the cancer cells or, an improvement. So there could be a role there with respect to ketone bodies. Check out Dr. Dominic D'Agostino's research. He and Dr. Angela Pah focus a fair bit on cancer research as well. So there's some really great research looking at the role of the ketogenic diet or beta hydroxybutyrate when it comes to cancer. But again, you have to work with your healthcare provider and make sure that they say that that is safe for you. Can't seem to break the carb cravings. Any suggestions? My suggestion is always the fasting. Intermittent fasting, and then making sure that you're getting high healthy fat during the day. If you are transitioning into a healthy diet, some people will do a really severely calorically restricted diet. It's a lot of protein, a lot of veggies, they're not getting the fat, and then by the end of the day, people are just really hungry. And I find that that contributes to a lot of carb cravings. So intermittent fasting, I find, is a really great metabolic reset. I find that that's very helpful for helping to manage the carbohydrate cravings. And you have to make sure that, again, you're eating those healthy fats during the day, or else I find people will absolutely start craving not just carbs, you crave a lot of food in the evening because you don't feel satiated or and you don't feel full. Constipation. So I've touched a lot today on hydration. And so usually the constipation is a sign of a mineral or nutrient deficiency. So what I would suggest is increasing your magnesium. Most people are magnesium deficient. It's a really essential mineral. And then again, when we lose some of those minerals, we can lose some of the magnesium as well. So you have to make sure that you're replenishing that magnesium. Most of my patients, whether they're keto or not, are on magnesium. Most people need that. It's also a very relaxing and calming mineral, so I have patients take it in the evening before bed and just keep increasing your dose. If you're constipated, you just keep increasing your dose before bed until you have regular bowel movement the next day. And then just sort of find that dose that allows you to sort of stay regular. But often, again, it's just a sign of a magnesium deficiency, which can contribute to constipation. And again, making sure that you're getting those electrolytes in and you're drinking a ton of water. So blood pressure. So I saw some blood pressure and cholesterol questions. So the concern is always, will this increase my cholesterol or will it increase my blood pressure? So with respect to exogenous ketones, no, it should absolutely not increase your cholesterol or your blood pressure. Unless someone has some kind of sodium sensitivity or something like that, then they need to be cautious with respect to their sodium intake, but otherwise most people are absolutely fine with the sodium content. They don't need to be concerned about an increase in blood pressure. It shouldn't cause, when you're taking exogenous ketones, it should not cause an increase in your cholesterol levels. There is often a concern with the ketogenic diet if the ketogenic diet will cause an increase in cholesterol. What I often find is that if somebody is transitioning from a low-fat diet to a keto diet, we absolutely see an increase in cholesterol initially, and then afterwards it just sort of balances off. And so I usually tell people, don't check your ketones, or your cholesterol sort of 3 months after starting a ketogenic diet. Just give yourself about 6 months, or if you do check and you notice a bit of a spike, give yourself some time, allow your body to adapt and adjust. Usually those cholesterol levels just come right back down and sort themselves and sort of stay within a normal range. So I don't find that the ketogenic diet is increasing the cholesterol, but you will see a little bit of a spike and back down. And some of the research that we've seen coming out looking at a high-fat diet versus a higher carbohydrate, low-fat diet, they're showing that the higher fat diet is more beneficial in managing cholesterol and blood sugar, and also waist circumference, which refers more so to that visceral fat, which is that fat that lies not just under the skin, but surrounding the organs, and that can contribute to metabolic syndrome. So they're finding that higher fat diet is actually more beneficial, the higher fat, low carb. So you shouldn't necessarily see an increase in those levels. Can those with epilepsy take exogenous ketones? Yes, absolutely. Of course, it's, again, work with your healthcare provider. It's important to remember that the ketones will not cure any medical condition, but work with your healthcare provider. We know that the ketogenic diet was created in order to help manage children who are seizures in children with epilepsy. So if your healthcare provider says that that's safe for you, then I'd say absolutely go ahead. Can people with high blood pressure or on medication take exogenous ketones? So again, you have to work with your healthcare provider, but I do have a lot of patients who are on high blood pressure medication that I do have taking exogenous ketones or on a ketogenic diet. If somebody is concerned, then I usually just recommend making sure you leave some time in between the exogenous ketones and your medication. Just make sure there's, maybe a 2-hour space of time just to make sure that there's no interaction there. What could cause a patient to experience fatigue with ketones? Or muscle fatigue with ketones. My question would be more so if, again, it's that loss of, and I think you're saying someone with muscular dystrophy. The question would be more so if it's, the mineral imbalance. That's what we see more so if someone has a lack of minerals, or if they need to sort of replenish that magnesium, those electrolytes. So I would say make sure the fluid intake, and things like that are nice and high, and you're getting all of those electrolytes. Just put your mitoplex right in with your ketones, and that you're taking magnesium as well. So should potatoes, starches, bread, and fruit be discontinued? I'm assuming you mean on a ketogenic diet. So I wouldn't necessarily say they have to be discontinued. It's not like you can never eat those things. It's just eating those things in moderation. The ketogenic diet is not a zero carbohydrate diet, it's a lower carbohydrate diet. So it's just choosing how much of those things that you're going to consume. So it's choosing how much of those things you want to consume, but you want to reduce those amounts. If you do consume fruit, I always encourage people to have berries. Berries are always, they're very low sort of sugar containing fruit. So that's always a great option as well. And then in moderate amounts, you can have some of the potatoes and things like that. If there is a therapeutic outcome, I make my patients take them out. most of my Lyme patients, I'm making them just take them out altogether. But if we're not really looking for a therapeutic outcome, then it's fine every now and then. Lots of high blood pressure questions today. I just touched on that a little bit earlier. And same with the cholesterol question. You just measured your cholesterol and it's higher, so just rewind a little bit. I just touched on that as well. So lots of the cholesterol questions. So I just touched on that. Rewind a little bit. So a nut allergy. So someone is asking about a nut allergy. So I don't know if the question is if you have a nut allergy, can you follow a ketogenic diet, or if you can take exogenous ketones? So yes to both of those questions. You shouldn't have any issue. Obviously, a lot of people try and keep their fats high by consuming nuts, but there's so many other great healthy fat sources, avocados and oils and things like that. So yes, absolutely. So migraines, I don't know if the question is it's causing a migraine or will it help with migraines? For those who say that they're experiencing headaches, again, rewind a little bit to earlier. I've touched a lot on hydration, water, electrolytes, magnesium, all of those things. And those would all help if you're experiencing headaches when you transition into a ketogenic diet. So just rewind a little bit. And then the question if it could be beneficial for migraines, there is some research that they're doing with respect to beta hydroxybutyrate and migraines, showing that there could be some benefit or improvement there due to the impact it has on our circulation, vasodilation, vasoconstriction. So there could be some benefit for you there as well. So we are out of time today, everybody. Tons of high blood pressure questions today. Just rewind. I keep seeing the blood pressure question. Rewind. I touched on that a little bit earlier. Hopefully I answered most of your questions, lots of diabetes questions as well. So just rewind a little bit. I did touch on that earlier in the call as well. So it was wonderful connecting with all of you today. I hope you're all staying safe and healthy. I can't wait until we can meet again in person. It's always one of my favorite days is sharing and educating, and obviously always connecting with all of the Pruvit community is probably one of my favorite parts. So I'm looking forward to connecting with you live again. Otherwise, stay safe, stay healthy, and enjoy the rest of your week.